Why are some people leaving Medicare Advantage plans? In this video, I'm going to answer that question, so stay tuned. I'm Calvin from PlanFit, and my team helps thousands of people every year to find the right Medicare coverage for them. And so you may have heard people talk about how Medicare Advantage plans have all of these great perks like dental, vision, hearing, and gym memberships, and even maybe a flex card that will help you to do things like pay for groceries or utilities. Often, they give these at a $0 premium. So if Medicare Advantage has all of these great perks and benefits, then why would anyone leave it? Well, the first reason why some people leave their Medicare Advantage plan is that they don't like limited networks. Most Medicare Advantage plans come with a network of doctors and hospitals, so you can really only go to those specific doctors and hospitals that are in the plan because the plan covers those unless it's an emergency. In an emergency, you can go to any hospital. So if you need to see a doctor or specialist, that means you can't just make an appointment with any doctor or with the nearest hospital. You need to make sure that the healthcare provider or the doctor that you're going to is in the plan's network. Now, if you live in an area with plenty of healthcare providers, then these plans can actually have a lot of doctors and a lot of hospitals in the network all around you. I find that people who are on Medicare Advantage plans in these areas with lots of choices, they tend to like their plan quite a bit because they just choose the plan that has the doctors that they like in the network. However, for people who live in more rural areas, networks can be a lot more difficult because you may not be able to get what you want. Imagine having to drive an hour away to see your in-network doctor when there's another doctor that's just right around the town where you live. Now, some Medicare Advantage plans do allow you to go to out-of-network doctors for higher fees, but overall, the people leaving Medicare Advantage plans often are doing it because they hate how limited their network is. Another reason why people sometimes leave a Medicare Advantage plan is because they live in more than one area. If you have a home in one state and a home in another state, then that can be a problem, because most of the time doctors and hospitals are in networks and they're going to be close to your home address. But if you have two homes and you go to your other home, now you're out of network. So if you move around a lot from state to state, getting coverage for you can be difficult with a Medicare Advantage plan. Now remember, your plan will cover emergencies no matter where you are when you're traveling. But outside of that, you could get stuck paying 100% out of pocket for basic health care if you're out of your network because you're in another state where you don't live. This is one of the big reasons why some people leave Medicare Advantage. The third reason catches a lot of people off guard, but yes, your favorite doctor can leave your plan's network. Your favorite doctor has a contract with your Medicare Advantage plan and it may expire. And when it does, they cannot choose to just renew their contract. They have to negotiate it with the insurance company and make sure that both are in agreement that it will continue. And if they leave your plan's network, you may not be able to leave yourself because it's not open enrollment. So they may leave your plan and you might get stuck there and have to find a new doctor. So what can you do in that situation? Well, you can either find a new doctor in network, or you could change yourself to a new Medicare Advantage plan that your doctor now accepts. Now, the problem with that is you could only do that in certain windows. If it's not open enrollment, you may not be able to do that. Lastly, what you could do is you could switch to a Medicare supplement plan that lets you see any doctor nationwide. But again, you have to do that in certain windows because you can't just drop your Medicare Advantage plan at any time. So whenever you choose a Medicare Advantage plan because of your doctor, always be aware that this does not mean that your doctor will necessarily take that plan forever. The fourth reason why people are leaving their Medicare Advantage plan is because their plan coverage has changed. See, these plans, they can change their coverage every calendar year. This includes the ability to change things like monthly cost, the cost of using the plan, the network doctors and hospitals, and even specific prescription drugs that they cover, or sometimes the plan itself completely just has to shut down, and in that case, you're forced to change plans. And if one of these things happens, you have the opportunity to decide if you're going to continue with Medicare Advantage or if you're going to go with a Medicare supplement. One of these things I want to focus in on here, which is the change in prescription drug coverage, because this is a huge reason why some people leave their plan. So many people like their Medicare Advantage plan because it often includes prescription drug coverage, so you don't have to pay anything for a separate plan. But prescription drug plans can change from year to year. Last year they may have covered your prescriptions, and then next year they don't because their formulary has changed. That's the list of drugs that they cover. And now you have to consider, am I going to go to another Medicare Advantage plan? Am I going to consider a standalone prescription drug plan and go with the Medicare supplement? Because you have to have that covered. Now, if your Medicare Advantage plan does drop your medication, you can't just switch drug plans. You have to change your entire Medicare Advantage plan because it's all connected. Now, aside from prescription drug changes, the other common reason why people sometimes leave their Medicare Advantage coverage and go to a Medicare supplement is because their plan completely closes, locks the door, is out of business. And usually that's not a common thing. But last year, we had more plans shutting down than ever in the history of Medicare. So in that case, if you lose your plan because your plan closes down, you have the guaranteed issue right, or guaranteed right, to get a Medicare supplement plan. And that's one of the reasons why we saw a lot of people leave Medicare Advantage last year, was because they had the opportunity without medical underwriting to go to a Medicare supplement plan. That was such a big deal at the end of 2024. We had so many plans that went away and major plans closing. And so I made an entire video about it, which you can check out in the description below. But don't worry, if your plan was closing, then they had to send you a non-renewal notice before the beginning of last year. So that's not going to happen now in the middle of the year. Very, very unlikely. If your plan is still in business as of January 1st, 2025, that'll continue through this year. But the main takeaway here is that if you're enrolled in a Medicare Advantage plan, always look out for your annual notice of change document in September, which is the document that tells you what's changing the next year, because that's where you could find these unexpected changes that have an impact on you. One of the main reasons why people choose Medicare Advantage plan is oftentimes for the $0 monthly premium. So if you don't have to pay, why would you ever leave? Well, one of the reasons is because the cost of actually using your Medicare Advantage plan may be higher than you expected, and may actually be higher than the cost if you had maintained a Medicare supplement plan or had a Medicare supplement plan. What I mean is, if you get seriously ill and you use a lot of services on your Medicare Advantage plan, you could end up spending more on that plan, even though it's a $0 monthly premium, than if you had maintained a Medicare supplement plan. And for the last point of why some people are leaving their Medicare Advantage plan is that they don't like referrals and they don't like prior authorizations. They don't want anyone to say, no, you can't go to that doctor or you can't have that treatment. Not that that happens all the time with Medicare Advantage, but it can happen. If you are one of the people with a Medicare Advantage plan and you want to leave it, what do? Well, the good news is, if your plan isn't working for you, there are ways to get into a Medicare supplement plan instead, which would allow you to avoid most of the things that we've talked about here. Like, for instance, you could go to pretty much any doctor that you want, as long as they take Medicare. But in exchange for that, you do have to pay a higher monthly premium, but that's the trade-off. If it sounds good to you, then here's a couple options that you have. Option number one is to pass medical underwriting. Medical underwriting means that the Medicare supplement company is going to ask you medical questions and figure out what your health history is and decide if they're going to insure you or not. They'll look at things like, how sick have you been? Have you been hospitalized? Have you had pre-existing conditions? Do you have cancer? Have you had a heart attack? Have you had a stroke? Things like that. As long as there are no red flags, it's really just a questionnaire, and then you get approved. But there are other ways to get out of your Medicare Advantage plan and get into a Medicare supplement plan without dealing with all that. So option two is to use something referred to as your trial rights. Now, if you were on a Medicare supplement plan and you went to a Medicare Advantage plan to try it out, and you've decided that you don't like it, or you want to go back to Medicare supplement, you can do that anytime within 1 year. As long as you do it within the first year of joining a Medicare Advantage plan, if you've left a Medicare supplement, you can switch back to Medicare supplement plans, no questions asked. So this is a great way to test a Medicare Advantage plan and see if it's a good fit for you. Now, if you find that it's not a good fit, like I said, you can just go right back to the Medicare supplement plan. But if you've had the Medicare Advantage plan for longer than a year now, you have to go through medical underwriting. If you can't pass medical underwriting, then the only thing you can do to switch to a supplement plan is by using a guaranteed issue right. A guaranteed issue right is the right to get a Medicare supplement plan, guaranteed, no questions asked. And it's not available, unfortunately, to everyone. There are specific scenarios where guaranteed issue rights are available. And one of them is if your Medicare Advantage plan closes up shop. So if your Medicare Advantage plan goes out of business, that is one of the guaranteed issue rights. Another guaranteed issue right is if you move out of your plan service area. So let's say that you're living in Phoenix, Arizona, and you're on a Medicare Advantage plan, and you move to Las Vegas, Nevada. Well, when you move, you are going to lose your Phoenix plan. And because you're losing your Phoenix plan after that move, that gives you a guaranteed issue right for a Medicare supplement plan. So those are a couple of examples. There are some others. There are other examples of guaranteed issue rights, but sometimes we are able to use those to help someone move from a Medicare Advantage plan to a Medicare supplement plan, even in a situation where they have health conditions and would not pass medical underwriting. So again, here I want to stress at the end that both Medicare Advantage plans and Medicare supplement plans can be right for certain people, but the trick is figuring out which one is best for you. Now, if you want to learn more about the differences between Medicare Advantage plans and Medicare supplement plans, I made a full video going over all the strengths and weaknesses of both plan types, and I would recommend that you watch that next.